Hi, welcome back to Everyday Behavior. This is the second video in our series this month. During this video, we're talking about the exact recommendations of sleep for children of various ages. This video, the recommendations are based on the American Academy of Pediatrics sleep recommendations. And so they have utilized research to determine what are the exact sleep recommendations or how much sleep should a child be receiving. And so what they've recommended is that children that are 4 to 12 months of age, on average, should be receiving 12 to 16 hours of sleep. That includes their naps. For children that are 1 to 2 years, they should receive 11 to 14 hours of sleep, including their naps. For children ages 3 to 5, they should receive 10 to 13 hours of sleep, including their hopeful naps. Every parent can hope that their 3-year-old or 5-year-old is still taking a nap. For 6 to 12 years, we're looking at 9 to 12 hours of sleep. And for children 13 to 18, 8 to 10 hours of sleep. So if I had to guess, most of us probably have the 1 to 2 years, we got that down, and the 13 to 18 years, well, we can pray. But one of the things that I want to focus on is that 3 to 12 year range. And so when you think about sleep, if your child is getting 12 hours of sleep and they're waking up at 7 a.m., what time does that mean they have to go to bed at? So depending on their nap, if they take a 2-hour nap, then they can stay up until 9, as long as they're consistently taking a 2-hour nap. But if they're refusing their naps or not getting their naps, or if their naps are shorter and shorter, maybe they're just 45 minutes to an hour, then they need to be going to sleep at 7 p.m. And especially those kids, once they get into pre-K and kindergarten, if they're going to full day school and they're not getting naps, then really we need to look at for those kids that are in those early grades being in bed and to sleep by 7 or 8 o'clock at night. And that can be hard. So I'm not saying that this is easy, but it's looking at how we can evaluate how much sleep does our child need and how can we work towards that. And so some of that may be changes to your systems at home. And so for us, it's really hard on a working night to get off at 5 p.m. to pick up kids, get home, make dinner, clean up, get baths, get pajamas on, read books, and get in bed by 7 p.m. However, we know that that's important. And so we have adjusted our schedule so that typically on weeknights, nights where we have to work until 5, that we make sure that our meals those nights are leftovers. So that doesn't sound great, but I always make sure that we have leftover meals or easy meals that we can simply reheat or heat up quickly so that we can spend less time on mealtime. That way we are able to get in bed. You also want to look at how can you look at your extracurricular activities. So when we look at sports right now, a lot of sports, I've heard of young kids having games that start as late as 9 p.m. And so I agree that extracurricular activities are valuable and have a place. So I'm not saying that your child shouldn't be in extracurricular activities. However, what's important to weigh is what is most important to you in your long game. Is your child's sports performance more important, or is your child's academic, behavioral, and intellectual performance more important? And then you need to decide, where is that going to fall in your priorities? So are you going to prioritize sleep, or are you going to prioritize extracurricular activities? So again, I'm not saying that you should not be involved in extracurricular activities. However, if your child's extracurricular activities are reducing the amount or quality of sleep that they are getting, then you need to revisit and reevaluate how that might impact them long-term or in the classroom. So you really want to look at your sleep routines and how you can evaluate, is my child getting an adequate amount of sleep? The American Academy of Pediatrics, their sleep guidelines, you can locate them by simply searching American Academy of Pediatrics sleep guidelines. But if you want the exact link, you can find it here. I hope that this information has been valuable and helpful. One other thing that I wanted to point out is if you find that you are following the recommendations and your child is not getting adequate sleep, make sure to talk to your pediatrician about that, because it could indicate that there is some kind of structural or neurological condition that is impacting sleep. And so one of the things that we do know is that concerns with ear, nose, throat, whether that's tonsils, adenoids, and something that could be disrupting sleep, like some early sleep apnea. It may be that you want to talk to your pediatrician to rule that out if you're noticing that your child still has sleep deprivation. But it also could be the sign of some other neurological concerns. And so in those circumstances, you again want to talk to your pediatrician and maybe even request a referral to a sleep specialist. Thank you and have a great day.